We are discussing about the diagnosis of Mysthenia gravis. How would you will diagnose the Mysthenia gravis patient? The Mysthenia gravis is diagnosed when there is weakness. We will diagnose the Mysthenia gravis when there is weakness of the muscle, when there is weakness of muscles. If the muscles becomes weak and there is no contraction or contraction decreasing, we suspect that the patient is suffering from Mysthenia gravis. The fatigability is a typical distribution without loss of reflexes. There must be fatigability. This fatigability is without the loss of reflex, without loss of reflex. If reflex loss, we call areflexia. This is Miller-Fisher syndrome, but in the Mysthenia gravis, without loss of the reflexes occur in the Mysthenia gravis. We will do a test called ice pack test. Ice pack test. In the ice pack test, we pack and we put ice on the patient of the eye that was puptotic eye. If the symptom improve, this is the suggests that the patient suffering from Mysthenia gravis. We put and keep ice on the puptotic eye of patient which was suspected of Mysthenia gravis. If the symptom improve, we suspect that the patient is suffering from Mysthenia gravis. Autoantibodies in Mysthenia gravis, we can check it. We can check the autoantibody in the Mysthenia gravis patient. Autoantibodies. Autoantibodies. We can check the autoantibodies in the Mysthenia gravis patient. The autoantibody against the acetylcholine receptors, they are found in 85% of the cases. In 85% of the cases, the autoantibody against the acetylcholine receptors are found in the Mysthenia gravis. In 15% of cases, the autoantibody against the acetylcholine receptors are negative in 15% of the cases. The autoantibody against the acetylcholine receptors are found in 85% of the cases. In these 85% of the cases, the 50% of the patient has ocular impairment, has ocular involvement. The ocular muscle weakness occur in 50% of the cases of these 85% of acetylcholine receptor autoantibody positive. Autoantibody are positive in 85% of the cases against the acetylcholine receptors, and of these, the 50% of cases has ocular impairment and ocular muscle involvement. The presence of autoantibody against the acetylcholine receptor, we can diagnose the Mysthenia gravis, but in 15% of cases has negative acetylcholine receptor antibody. It does not mean that the patient has not the Mysthenia gravis disease. The negative result does not mean that the patient has not Mysthenia gravis. Sometimes the acetylcholine receptor antibody in 15% of the cases are negative. The negative does not mean that the patient has no Mysthenia gravis. 40% of acetylcholine receptor negative patient, 40% of acetylcholine receptor antibody negative patient has another antibody against the MuSK, against the muscle specific kinase. About 40% of the negative antibodies against the acetylcholine receptors, the 40% patient has antibody against the MuS receptor, MuSK MuS receptors. They have antibodies also, but against the against the MuSK. They have autoantibody against the MuSK. But this with MuSK has generalized Mysthenia gravis, while in 50% of the cases of autoantibody against the acetylcholine receptor have ocular involvement, while in the autoantibody against the MuSK, patient has generalized Mysthenia gravis. This patient has generalized Mysthenia gravis, while that of the acetylcholine receptor positive antibodies, or 50% of these, have ocular involvement, and against the anti-MuSK antibodies has generalized Mysthenia gravis. How will we diagnose the Mysthenia gravis with the help of history? This was on the investigation basis. On the history, there must be diplopia, ptosis, dysphagia, and dyspnea. There must be diplopia, dysphagia. There must be the symptoms of diplopia, dysphagia, ptosis, drooping of the eyelids, ptosis due to weakness of the ocular muscles. There may be dyspnea due to pharyngeal muscle involvement. There may be dyspnea. The weakness of proximal limbs can also occur. Weakness of proximal limbs. Weakness of proximal limbs may occur in cases of the Mysthenia gravis. There may be the weakness of the proximal limbs. The neck may be extended. And the neck's muscle involvement in the Mysthenia gravis may be occur. The generalized symptoms may be present in Mysthenia gravis. The symptom of fatigue worse with activity. The fatigue in cases of the Mysthenia gravis become worsen with activity, and they relieved with rest and sleep. On the physical examination, there may be ptosis. The ptosis may occur at rest or at 1 minute of exercise. And relieved by ice pack test. The extraocular muscle involvement occur. There may be diplopia. Double visions because of the muscle involvement. One muscle contract and other become relaxed and weak. There may be diplopia. The orbicularis oculi muscle involvement occur. Orbicularis oculi muscle of the eye involvement may occur in the Mysthenia gravis. Jaw opening and closing problems occur because of the muscle involvement of the jaw. Jaw opening and jaw closing problems are prominent because of the involvement of the muscle of the jaw. Especially there is problem when the patient want to eat the meat. So there is the jaw opening and closing problem, and the speech become nasal because the tongue involvement is also in the Mysthenia gravis. The tongue muscle involvement also occur in the Mysthenia gravis. Decrease the strength of the neck extensor muscle also occur. Decrease of the strength of the extensor muscle of the neck muscle. Decrease the strength of the extensor muscle of the neck also occur because this muscle may be affected. On the lab examinations, what will we see? On the lab examination in the Mysthenia gravis. The lab examination, there is anti-acetylcholine receptor antibody. The lab examination, there is anti-acetylcholine receptor antibody. They are present in 85% of cases of the Mysthenia gravis. In 50% of these cases are positive acetylcholine receptor antibody positive, 50% of these cases have ocular involvement. 50% of these cases has ocular involvement. The muscle of the eye involvement, ptosis, diplopia, double visions. 40% of the cases there is acetylcholine receptor antibody are negative. Anti-acetylcholine receptor antibodies are negative in some cases. It does not mean that the patient has not a disease. Sometimes they may be negative and the patient has Mysthenia gravis disease. In cases of the negativity of these negative percent, 40% of these negative percent, they has another antibody positive, that is antibody positive for MuSK, muscle specific kinase. They have antibody against the muscle specific kinase, and this is immunologic response. So when the antibodies attacked on the muscle specific kinase, it damages the acetylcholine receptor also. This antibody are positive in some cases. Sometimes the hydrofonium chloride, by the injection of hydrofonium chloride 2 mg at the initial dose, then 4 mg, the symptom relieves. The symptom may be relieved. Symptom may be relieved sometime by the hydrofonium chloride 2 mg at the initial dose, then 4 mg, then 8 mg. We can also give 8 mg hydrofonium chloride. Hydrofonium chloride. This is highly probable for the diagnosis. The hydrofonium chloride is highly probable for the diagnosis. This is highly probable for the diagnosis of the Mysthenia gravis. First, we inject 2 mg of the initial dose of hydrofonium chloride. The symptom relieved. Then we can inject the 4 mg of hydrofonium chloride or 8 mg of hydrofonium chloride, and the symptoms may be relieved. This is highly probable for the diagnosis of the Mysthenia gravis. If there is not Mysthenia gravis, we inject the hydrofonium chloride 2 mg, then 4 mg, and until to 8 mg, and the symptom is not relieved. It means that the weakness is not due to Mysthenia gravis. If the symptom relieved by the injecting hydrofonium chloride, it means that this is due to the Mysthenia gravis.